Welcome to our corner of hope and resilience, where the battles with cancer and the triumphs over adversity are shared. I'm Pete, a companion on the journey of incredible survivors. While my battle hasn't been against cancer personally, I stood by those who fought and learned the true essence of strength and spirit. This podcast is a tribute to their courage, a space for stories of heartache and healing, celebrating every fighter, survivor, and supporter. Join us as we explore the profound journeys of living with, through, and beyond cancer. Together, we affirm you're not alone. Welcome to Cancer Conversations and our Circle of Hope.
Welcome, everyone, to Cancer Conversations. This episode is Echoes of Triumph. Today we're going to have a discussion on successes, what leads us to them, and how we treat them. And also what happens after you're declared success in your treatments. We are seeing more success in our treatments as we understand more and more about cancer, and that's the good news. We're not necessarily talking about survival rates. Survival rates are the estimates they use for large groups of people. They don't tell you what your individual outlook will be. The best way is that relationship with your medical team, and that's what we're kind of going to talk about today. And I have two very special guests, and they're very special to me. I'm first going to tell you how they're special to me, and then I'm going to have them tell them why they're special on their own selves. Jamie Wieder is my primary caretaker at Geisinger. She tells me what to do and when to do it at this point. And Dr. Bowen has the distinction of being the person that told me I have cancer, and it was a mixed day for me that day. But he's a brilliant doctor, and he did well by me, and he continues to do well by me. So with that, I will have them introduce themselves. Tell us a little bit about you, Jamie, and why you landed in this chair.
I was hoping Tom was going first.
Nope.
I'm a nurse practitioner with hematology oncology at Geisinger. I've been there for about 10 years. So I see patients while they're getting chemotherapy, help them manage their symptoms, side effects. I work with their families as well, and I see a lot of patients in follow-up long-term, like John. Before Geisinger, I worked as RN in Harrisburg on an oncology cancer unit, so my whole career has been cancer. I couldn't imagine being in another specialty.
Well, I, for one, am glad you are. Because, as she said before on this very podcast, I'm not a hugger until you became my patient.
I'm still not a hugger. I just let you hug me.
And now she's a hugger. Well, she's a hugger to me anyway. That counts.
You were hugged. Let's be very clear.
She's been like Ghostbusters. I've been slimed. and Tom.
Can you rephrase the question again? How did I end up in this chair?
Tell us a little bit about yourself and why you ended up in this chair.
So I'm an orthopedic oncologist. So I'm initially trained as a bone doctor, orthopedic surgeon, the kind of people who do like total hips and total knees and that sort of thing. And then have chosen to do subspecialty training and develop a subspecialty practice in musculoskeletal neoplasms, musculoskeletal tumors, which often include cancers, not exclusively to cancers. Does that help you?
I know that. That was just for those of you that don't know. I know that, right?
Yeah, of course. Yeah.
And that's why you're here, because you, of course, said to me, you have a problem.
Yeah. Well, you were referred. You had hip pain.
Yeah.
Right. Mm-hmm. And then an X-ray was obtained that showed an abnormality in the bone that was recognized as being a possible tumor, and then you were referred to me, and my job in that moment was to try to figure out why was there a hole in the bone?
Yeah. Right.
Yeah.
Right. And I'll not forget your kindness, because you really were I was like a deer in the headlights. When Dr. Gilfu sent me over to you, because happened on a Friday. It happened on a Friday where Dr. Gilfu said, "I want you to see a specialist." And Monday morning at 8:30, I was in front of you, and it all happened so fast. And it was. I'd like to say it was a wonderful experience, but you ultimately had to tell me some bad news. So, the first question. Let's talk about having a good relationship with your care team, because I think it's important, and it was important to me that you and I at first had a great relationship, because I could tell you what was going on. Let's talk about that, because that builds to the to where we're trying to hit the Triumph level. Yeah. Let's talk about that. So
that's foundational, right?
Yeah.
Like, and I think I would encourage your audience to think about that. Like, you don't actually have to like your doctor, and you don't actually have to be able to hug your care team. That's great that you can, and but that's actually not really as important as you might think. And your doctor might not look like you want, or they might look different, or they might be different. What you really just need is someone you can trust, that has your best interests in hearts and has the expertise that you need. That's it. Like, I think I mean, obviously, we clicked and we've gotten along well for these years, but that I would actually encourage people listening to say, no. They just got to know what they're doing. And you need to be able to trust them that they'll work in your best interest. And that's good. That's enough. So I think from the first day, my heart is to try to build that trust and understanding of with that patient. But it's challenging because, people are very different. We all have very different lives, and we have very different goals and very different hopes and dreams. And to be very honest, a lot of cancers are kind of the same more and more. I mean, they you can lump them together and give them names, and they kind of mostly act the same for the most part. But people, you don't know until you meet them.
Are you suggesting people don't act the same? That's very strange.
No,
I've never heard such a crazy thought.
That's very renewing to me, though. So when I walk in, you have a new diagnosis. I mean, I know what your X-ray looks like, and I know the educationally about what that means to figure it out. But what are you about, and who are you, and what are your goals in life, and how am I going to meet that? Your needs. So you're defining those goals for me.
Right.
Yeah.
And Jamie?
I'd agree with that completely. I mean, as far as the relationship, trust is a huge foundation, and just being comfortable with your provider. You need to be able to have conversations, ask questions. That's a huge part. And again, every single patient, that's what I like about working in cancer. It's interesting from a clinical standpoint, like the medicine part of it, but it's getting to know people and their families and what's important to them. It's very fulfilling.
And it has a huge impact on treatment. It has a huge impact on me. Speaking from the survivors and a patient of both of yours, it had a huge impact on me. The fact that I could trust people, the fact that I could say what was really going on, that I could say this is happening, or this hurt, or that didn't, or or I think what you're saying is total BS, or whatever it is. I mean that impacts kind of treatment plans. So let's talk about. Dr. Bowen touched on it a little, so I'm going to put him on the spot. So let's talk about obstacles to that relationship. So let's talk about what. I mean, you mentioned some things like you don't have to like your doctor. I was very fortunate. Pardon me. I was very fortunate in that everyone in the system that came across that I saw was very good to me. And as you know, Jamie, when I first started, they did a great regimen with me. After Dr. Bowen was done with me, I had to see everyone. They sent me to a neurologist. They sent me to sent me to a psychiatrist. They sent me to these other departments, and I've met all these other people, and they were all very, very good to me. So, what obstacles do you see to that?
Obstacles to the patient
Yes.
provider relationship. That's that's a hard one. That's a deep one. I think there are some practical obstacles, like physical obstacles, like getting an appointment, having a space in an appointment, getting to the building. And that's challenging for some people. Some people live a long way. You know, in our communities, there's a lot of rural. So,
Yeah,
so
for
getting
sure.
there, being in place, having that moment. So there's physical barriers. There's financial barriers.
Yeah.
Cancer's unbelievably expensive. I sit down at night and say, why does it cost so much? You know, it can't be that hard. Why? But it's unbelievably expensive. So there's real financial barriers
Right.
that are definitely in the way. Oh my goodness! I think there's a whole mismatch of hopes and dreams, and you know what we would hope versus like what does the technology actually have?
Right.
You know, I mean, sometimes the technology is faulty and unreliable and, you know, incomplete and not what we would want, or toxic, you know, has a lot of, you know, side effects. And so there's that barrier of trying to work through, you know, what we would want to give you,
Right,
what you would
right.
want, what we want to give you,
Right.
and what we have, you know. So sometimes I feel like, you know, sometimes I have a really good treatment and that's really fun, you know, and sometimes I got a used car,
Yeah.
you know, it's like it runs good sometimes, you know, and I'm like, and I have to be honest in that. And like, this is the best I got, you know, and,
Yeah.
those are all barriers that you can, you know, physical barriers, money barriers, barriers and expectations and versus what we can actually deliver. Those are all that come to mind. What else am I missing?
I think your point on expectations is a big one, and having the conversations like these are the toxic side effects. If I'm going to present to you that you're going to feel great after I gave you chemo and you feel horrible, yeah, that's not going to go well. You're not going to have that trust in me.
Yeah.
So it's having that open communication, and as providers, it's up to us to really explain this is what we're offering to you. It could go, you know, very badly. We hope it goes well, but these are the possibilities. So people have a clear picture of what we're getting into.
Right, and I think that's key. I think that's part of it. This communication that you have to have. You know, where and for the record, Jamie never said to me, "This chemo is going to make me feel better." Never, not once. She said, "You should start to feel better in about 3 years." That's what she said to me.
Yeah,
No, I'm
for
kidding.
the record, it did in the end.
It did. No, it did.
For the record.
It did make me
Just
feel better.
to defend her a
In
little
the
bit
end.
over
No,
here.
no, that's a true story.
Yeah.
But she didn't say that day, you know, or thereafter, or soon thereafter. So let's talk about experiences with caregivers real quick, because caregivers are a huge part of our community. And I want to talk about caregivers and that aspect of things. How have you found that? What value have you found in your experiences with caregivers and patients and the relationship they have with you?
I mean, just having caregivers and that support is just huge for both the providers and the cancer patient. To offer that support, you know, at home when they're not with us, reaching out to us when the patient may not, and being able to ask those questions that the patient might not be comfortable or not have
Yeah.
thought of. Sometimes we have caregivers that come in with like notebooks. They have everything written out. They have schedules planned, appointments set up for other specialties, and I think it would be really hard and difficult for patients to do that on their own.
Yeah.
I would agree with that. I take care of not only adults with cancer, but children with cancer, are particularly vulnerable because they you know, they don't have any money, can't drive, you know, some basic needs. And, you know, our children are wholly dependent on others to care for them. And
Right.
actually part of like what we call staging of their cancer, really fully kind of describing what we got before we even move on to talking about what the treatment would be, is do they have like you know, parents that are going to be caring for them? Do they have parents that are invested in their care? Do they have? I really think that's your survival from cancer is dependent that you are nested in a circumstance where there are caregivers around you to get you through it. I think doing it alone is hard at best and maybe impossible, and I think it directly affects survival. Like caregivers improve survival. You know, a good caregiver means better chances of survival. I don't know how you feel about that.
No, it's 100% accurate. I mean, for transplant, and you know this, like if patients don't have caregivers and a support system, we sometimes can't move forward with transplant to cure patients.
Yeah.
And it just shows
heavens.
how, you know, much that's needed and how
Yeah.
important it is.
Well, I'm sure I could rent my mother out. She was the one that pretty much got me going.
Yeah.
Yeah, get these jogging pants on. We're going to get your treatments.
It often is.
Don't keep Jamie waiting.
Blood relative family. That's
Yeah.
and that's wonderful and that's meaningful. But it doesn't have to be. It just got to be someone who's going to be there for you.
Right.
Or a few people that's going to be there for you. It doesn't have to be.
Yeah, we have a lot of patients that like close friends, individuals from their church, really just the community helping them out.
Yeah, and it's important. It really is important for that because we are social. We are social creatures, and I think for me, I've said this before, that exponentially helped the healing for me. That's one of the things that had me bounce back. I thought I wanted my alone time. I thought I wanted to be here. I just want to lay here and sulk. Because I've got a bad
There's a moment for that.
Yeah,
I mean, you get that.
But no, I wasn't getting it. I wasn't getting it. She was like, "Let's go. You're up. Let's go. We're going."
Yeah.
Yeah.
You have a speaker.
Oh, yeah. Go on, Diane. Yes.
Microphone.
Thank you. Just in addition to, for both the patient and for the caregiver, the health systems do have support ready for so many different situations. But there's case management, right? There's social work. There's community health assistance. There's, again, we mentioned that, but there's the Area Agency on Aging in different communities. So there's so many other resources to help that patient and that caregiver to be able to cope and to be successful through their journey.
Yeah.
Just a reminder.
Yeah, that's a good reminder, Diane.
Yeah.
And many people have trouble asking for that or finding it. Where we have to say, hey, it's out there for you, and we can help you with that.
And the departments, oncology, they have case managers, right, and social workers. Again, so each department's transplant, they all have resources available, and it's important to take advantage of those things that are there for you.
Yeah, no, it's true. And you segued into my next question beautifully. Thank you, Diane. And you didn't even see these questions. It was great. It was great. But I see Dr. Nick is in the audience, and it's wonderful to see him. But we have talked, when we had Dr. Nick on, we talked about that. Are you both, in your day-to-day, are you finding that more people are asking for help, more people are telling you the right things, more people are doing the things that, that would help their treatment to get to success?
I think we're doing a lot better at getting patients to resources and bringing up those questions than we have, historically, especially, with having Dr. Nick in our clinic. It works very well. He's down the hall. So a lot of times I can just grab him and introduce him to somebody because sometimes it's just the introduction to, our caseworkers, our, behavioral health, psychologists is just enough to get the foot in the door to get patients talking and requesting more help.
Yeah. And because he did mention that, Dr. Nick did mention that that's happening more and more. I'm thrilled to hear it, but I wanted to hear more about it from, are you finding that, Dr. Bowen?
I would say that I don't have Dr. Nick in my office, so I might be a little bit jealous, although I know you guys are just down just across the parking lot here. So, but I do think that over the long arc of my career, since the last 15, 20 years, that I think we are recognizing that we need to be more comprehensive in our care. Just having the right drug or having the right surgery, a doctor coming and imposing a treatment without understanding the circumstances in which people are in is going to be futile, or at least certainly not turn out the way as good as it could.
Right.
Yeah. So
Right.
I see our culture respecting the importance of caregivers more and more. Mm-hmm. There's progress to be made too, though. We're not done yet.
Right. Yeah, and I agree with that. On a side note, listen. These two probably know more about me than they should, but I've learned that this experience has taught me to tell someone, to tell them. Yeah. If you don't feel right, if you're thinking, Jamie, and I've said this before, and I'm sorry, Jamie. When I would go in and see her, she would say, "Do you have any dark thoughts? Are you okay?" you feel it. And I'm like, I'm insulted. Why would you think I have dark thoughts? I'm the most sanest person I know. But she's looking out for me. And at some point, if I ever get those thoughts, I'm going to say, yeah, I do. What can I do? Can you help me? And you know what she's going to do? She's going to help me. She's going to put me on Dr. Nick's couch again.
I was going to say, to Dr. Nick.
Yeah. That imprint on his couch is me, not you.
But, if you have a new diagnosis of a serious change in your health, like, I don't know, like a cancer, I mean, you're going to have some dark nights.
Sure.
Like,
Sure.
there's no way around it. I tell patients that, like, if you are running really hard and you feel short of breath, does that mean there's anything wrong in the sense of, like, with your heart? Probably not. Probably you're just running really hard. Stop running and see what happens, and then I'll tell you if your heart's okay. Like if it goes away, but like if you have a new diagnosis of a major illness like cancer, and like if you're not having a few dark thoughts, then maybe you didn't hear what I told you. And so like I'm hardly a mental health professional, but I would say like it's good that like we need caregivers, we need providers, we need to talk about it, but that doesn't necessarily make like a diagnosis.
Sure.
Yeah.
No,
In fact, that's almost a universal experience, I would think.
Yeah, but that's the stigma attached to it, though. When if I'm having these thoughts, something's wrong with me.
Yeah.
I can't tell him. I can't tell anyone. But you need to. Just like if the plumbing's not working or if it's blocked up or whatever you're doing, tell someone.
Yeah.
Because it's only going to lead to more trouble.
Yeah.
And I think normalizing some of that as well. Like,
Yes.
Patients after finishing, cancer therapy, there's expected anxiety, fear of reoccurrence, and those things are normal.
Right.
We see them all the time, and it's okay to talk about it.
Right. And that's what we need to get to. And that's what I'm hoping we elevate this conversation to that. So let's talk about success. Let's talk about successes. I like the smiles on your faces. That's
happens.
Great. That's great.
It happens.
It does happen. It absolutely does happen. And you and I had a great conversation with it, which is why we're here today, to talk about successes. So I know that as we talked about in this episode, treatment's different, people's different. Cancers can be lumped, as you suggested, maybe this, but treatment, people, different. In general terms, what does success look like? In general terms, what does success in cancer treatment look like?
I think it's going to be different for every individual.
Sure.
I'd love to be able to say we cure everybody. It's just not the reality of the situation. Sometimes it's going to be just living well with cancer, continued monitoring, like for yourself, or just long-term follow-up for individuals that finished curative intent therapy. Otherwise, ongoing treatment, keeping cancer under control, keeping symptoms under control. And there are cases where, just dying well with cancer as well is something that is a goal for some people. It's something that we need to address. So it's going to look different for every individual.
Yeah, I mean, I totally agree with you. I'm going to take a different philosophical approach, but I don't want to. You're right.
You do you.
Yeah, right, exactly. But I have a different approach to this. Science tells us how something might happen, and it can help us predict what the future might be, although often imperfectly with cancer, at least our current science. But it doesn't tell us why. What the meaning of that is. That's like a non sequitur. That's a it doesn't exist. Why doesn't exist in science? It's a non-event. And so it is the patient that I don't know, gives meaning to the circumstance, and it is the patient ultimately that has to set the goals of what their treatment would be. And when I'm at my best, I would actually ask you, what do you want? Oftentimes it's implied, but if you ask, it might not be what you think it is. Like you have to ask, like, what are the goals of care? What would you hope for? And then I have to have that honest response as to what I got to give you. I might have the cure, and I might have the used car, but like then we can have that conversation about defining the goals of care. But science and the science of medicine is never going to get to that that real answer of what is success, because success is defined by that meaning of why, what it is to be alive, what is the meaning of our life in the midst of our cancer, not because of our cancer. Does that make sense? Did I come out right?
There's echoes in my head when I saw you and you said, no running, jogging, or jumping. So, and if you remember what I did, I went back to playing basketball. And he was like, he's not listening. Of course I wasn't listening.
No, you listened.
Yeah, I listened for
You
a
heard
time.
me.
Yeah, no, I heard you, because clearly I'm going against that. But listen, but that to me was one of my goals.
Right.
That
You
was
defined
one of my
it.
goals.
Yeah,
and
right.
then when he saw that I'm clearly not going to talk this idiot out of this, he said, "Don't break any bones." That's what he said to me. That was his advice. Just don't break any bones.
So you had a tumor near your hip, right? And
Right.
I was worried about the risk of fracture, right? And so I expressed that concern or risk for you.
Yep.
You weighed that relative to your goals and your preferences, and you made an educated decision. And I was with you in that.
That's right.
Right.
That's right.
And had a bone broke, God forbid, I would take care of you in that, and we
Right.
would be in right relationship.
Sure.
Right.
You wouldn't snicker at all and say, "I told you so."
I would try not to. I am human, But that's actually gets back to that relationship, right? That's so important between a caregiver, because that term non-compliance is such a loaded term. It suggests the patient isn't doing what we told them to do, and we have to use that term sometimes. But I would say you were not non-compliant. You heard me.
No.
You chose otherwise. That's not non-compliant.
It's a true story.
Right.
So I mentioned in the first episode that survivor, should be responsible for their treatment. As you already indicated, you should be responsible for treatment and your goals and for that success. I mean, the doctor, the medical team can give you those tools. So what would you see as important things for the patient to do or to continue or to begin doing after formal treatments are complete? To have a more, and I won't say success, but a more positive outlook. So what would you say, how do we get them to stay on that, whatever that course is? And there's a follow-up to that, how do we get the medical community to get on that page?
Can we put that one aside first? Can we talk about that a second?
Yeah, we can do that. Yeah. Talk about the patient first. Go.
All right. So I think we actually, after you have a cancer diagnosis and have a treatment, and then there's a long tail of surveillance, right? We have this process of monitoring for local recurrence and for secondary effects of treatment, and that requires visits that you come and testing, and I think that is often a time for patients to have anxiety. Is the test going to show my cancer is back? Is it, and understandably so. But I also would say that is a time when we have to, and we've done this, that is a time when that's done and that visit's nearing the end and things are going well, you have to stop and say, remember, this is success. Remember, our goals were to take a trip somewhere special or to play basketball or do whatever it is. It's a time of saying, you have to stop and remember and be thankful for that. And I think we forget to do that.
Yeah.
We're in this kind of to-do list, checklist, surveillance, year 3, got to do this, and then check, and back to work, and we forget
That's
to
a great point.
take a moment of like, hey, wait a minute, like this is full success, this is partial success, this is failure, and then redefine where the next steps are. But we forget to take those moments, and those anniversaries are not just to-do lists. They're days for celebration. That's why I love actually what keeps me doing this is actually not the day when you have to tell someone bad news.
Right.
I don't like that either.
Right.
Like it's not really fun for me. I'm kind of laughing.
Can't imagine that.
Yeah, it really stinks. But like seeing you in follow-up, oh man. It's like you win the lottery. That's like, I don't know. I feel that with you. I share that with you.
No, it's true. And,
Yeah.
well, Jamie, of course, we have that relationship, but every time I see him, he smiles when he comes in the room. And it's a true story. Every time you come in that room, you smile at me. And that helps, even if you're going to tell me bad news, like you can't play basketball anymore because he knows I'm not going to try that. I'm not going to listen to that. You have anything to add?
No, I think that was said perfectly.
Great. Now we can talk about the medical community getting on board with that, because I know he's dying to talk about that.
Gosh, getting people to work together and do things together is really hard, and it takes a lot of time. I mean, I think for us, it means we have to be together after the pandemic. How often do we get together like we used to? You know, we have to have meaningful conversations together, and that's the other side is that's really expensive. I mean, think about how much time it takes to put, 50 doctors in a room, or not just doctors, but the whole care team in a room. Like, think about like hourly salaries, how much that costs. It's fortunes. So I would say I don't know. That's hard. That's moving. You move that needle a little bit, you make a big difference.
But are you seeing? So how would you measure? Use me as an example. I'm not doing anything now, really, but seeing you. I see you once a year, and I see her once a quarter.
And last time we met, we wondered, like, what are we doing here?
Yeah, why am I here? Why am I here? Right.
That was an open conversation.
Right. Yeah, because he keeps discharging me, he keeps dismissing me. I keep coming back. It's like the mob,
Yeah.
But for me, so I mean, you could have easily put me on something, kept me on Revlimid. We could have easily done that. But at some point, somebody said, you said, stop that.
Yeah.
Don't do that again.
time.
We've achieved what we need to achieve. Let's just honor this success and keep going on. We're going to monitor this, and we're going to go. And at what point do we do that? And are we seeing less of that or more of that? Or is that the norm? Am I not normal? Am I not normal?
I mean, no, I can.
I mean, you're not normal, but no, I think we have more and more of those conversations. Looking at the whole picture, at least from like my perspective with chemotherapy, immunotherapy, where we have to consider like patients that have been on maintenance therapy for 5 years and there's
Right.
no signs of cancer. We don't know the benefit of staying on it. Yes, we know there's a potential risk, but we know there's side effects, and that affects quality of life. So those are all discussions that we have together. And I think, that's something we are seeing more frequently as we're getting better at treating cancer. As far as, adding to kind of the checklist of those, long-term follow-up visits, I know for myself and other providers I work with, I think it's hard to do big system, like you said, getting 50 to 100 people together to come to an agreement on how to manage things and how to present cancer wellness and survivorship. But I know for myself and other providers I work with, sometimes it's just being mindful of the interaction, forgetting about like my checklist, not just for that visit, but the patient I have after you and the patient I need to tell them that their cancer is progressing, and just focus on the moment where this is a success for the individual that we're saying is still cancer free. And that moment for them is the biggest, greatest thing that's happening that part of their day.
Right.
And just being very like mindful of that interaction.
Right. That's a huge point. That's a huge point.
When I came out of medical school in 2001, I'm not a historian of myeloma or cancers in general, but my memory is I don't think we had any effective treatments for myeloma. We gave people steroids, and their life was short. In orthopedics, when I was a resident, so that's between 2001 and 2005, if we had a patient who was diagnosed with myeloma, we often didn't schedule follow-up because there wasn't a lot of follow-up to do. So this is to be here now, in 2024 and have a person in remission. And like, this to me is like, oh, this is really fun. I kind of feel like the kid who found the light switch. The first time a kid finds a light switch and he hits it, and all of a sudden the room goes dark, and then he turns it back on, and it gets bright. It's just like, what? Oh, this is real power. This is real fun. So I have that sense of feeling with you, but others like you, where it's like, no, wait a minute, we've really made real meaningful progress. We don't celebrate that enough.
Right.
Yeah. And of course, does everyone get that? Of course not. And we recognize that. But that happens, and where it wouldn't otherwise historically. And I think we so quickly take something like that and it just becomes part of the normal day. We I don't know, there's probably a fancy name for it, but we just internalize it, and it's just, yeah, you know.
Dr.
it.
Nick?
Yeah. There's a guy in the back of the room who knows what that means. But it becomes just, we just assume that's how life is, and we move on, and we forget the miracle that it is. And, you know, and so taking those moments of being, you know, thoughtful or mindful about, like, oh, this is really a blessing. This is really a wonderful thing. You know, this is worth doing and worth struggling for and worth fighting for. Right. And yeah, it cost a fortune. Well, it'd be nice to make it a little cheaper, but it was worth that too. You know? Right. Yeah.
Right. It was worth all to get to that point.
Right.
So let's talk to the audience. I want to hear success stories, and I know there are some in this audience. And I'm going to call on Veronica. If you'll pass that microphone back to James Ferrari, that'd be great. I want him to just tell us a little bit about his success story.
John, you're absolutely correct about our healthcare workers here. They're incredible. I had, in 2021, Whipple surgery. And if it wasn't for the healthcare people contacting me and going through the system, it becomes a full-time job having cancer these days. We start to learn a lot. Our technology has moved so much faster than it's ever moved. I'm wearing a sensor on my arm right now.
Yeah.
So it has moved, no pinching. But if it wasn't for our healthcare people, I have more doctors than I have friends now.
Oh, boy. I'm sorry.
No, that's great. We play tennis together. We talk about the families. We have dinner. It's great, yeah. But without that care and without our community, and I think our community is really outshining itself at this period of time for most of us. I'm a survivor at this point. I'm feeling much better. I'm getting healthier, I feel. I have interactions with my doctor. Like today, I reached out to him and I said, the medical people didn't get our records. Immediately, it was sent to them. I got a response again. So the care workers do so much for our community and our journey into the cancer world that we have to applaud them. And the doctors, I also wanted to ask you about the Paget disease, another form.
Yeah.
Yeah.
I see it. See patients with that. That's a fascinating disease. I could nerd out on that for a little while.
Do me a favor, nerd out somewhat.
Yeah. Yeah. Do you want me to describe what it is?
Yes, please.
Yeah. So Paget's disease is an uncommon disease of bone. It's actually not a malignancy. And it seems to be a disease of the cells of the bone that cause the bone to remodel. The cells, the osteoclasts that eat the bone, and then behind that bone that's eaten is regrown. It seems to be a disorder of how the bone is remodeled, how those osteoclasts seem to become hyperactive, and the bone is turning over much too fast. But it's a fascinating disease because its incidence is going away. It used to be quite common. So of my grandfather's age in orthopedics, and maybe even my father's age in orthopedics as a young person, that would be a disease that every orthopedic surgeon would see. It would be common in their practice. And now I see, a case, every few months or something like that, but actually not infrequently. And we don't know why. Where did the disease go? Where did it go? And so this is a theory. It seems to have some genetic predilection to people of Northern European descent, but there has to be an environmental cause too, because the genes haven't changed in the last 50 years. The people are still the people. So we think it might have one theory is that it's a viral infection of the osteoclasts, maybe dog distemper virus or rubella virus or something that we're no longer, in the community. And so because of vaccinations and healthcare. And so maybe that's why it's dying out, but we can't recruit many people for research anymore. The research is closing because patients are going away. The other thing is we have a good drug for it, Zometa. is a really good drug. That's a drug you might have heard of before. That's often used for cancer patients, but it treats Paget's disease pretty well. Yeah, right. It poisons the osteoclast, which has side effects that can be problematic, but it shuts down the disease a lot. So it helps a lot. Does that answer your question?
It does. And do
Yeah.
you feel that after 5 years, that patient that you've been looking at,
Yeah.
their improvement, you want to just put them, say, okay, we're just going to leave things alone. It's just working. Everything's working for you.
I think that's where you got to have that conversation about, is the patient's goals of care met? You know, if they're walking like they want to walk, or their limb is functioning the way they want their limb to walk, then I think you say, yep, that's the goals of cares are met. There are late complications of Paget's that patients need to be informed of. There can be arthritis adjacent to the joint, so that can cause trouble. There can be fractures that can occur in the bone, or stress fractures, and then very rarely, and this is awful, it can lead to a secondary cancer, which is a terrible cancer. So people need to know about that and be informed of it. But if a patient's had stable disease, they're happy with their outcome, we don't have a cure for it, but it's treated, managed, then no, I don't know if they need to be followed for life. Yeah. Does that help you?
Yeah, great. Thank
Yeah.
you.
Do we have anyone else who wants to share a success story?
Dover Square.
Oh, there we go. Toss it over to Jeff.
Jamie, you're part of my care team.
Yes.
I didn't quite recognize you and when I came in, but as soon as I heard your name, so thank you.
You're welcome.
Thank
Yeah.
you so much.
She gets around.
We're all here together.
Yeah,
We all take care of each other.
for sure.
Yeah.
I was my cancer journey started with my cardiologist. He was the one that recommended that I get a colonoscopy. And I am 5 years from my original diagnosis.
Yeah.
Had my surgery in 2020 of January. Started my chemo in March when they shut the country down. So when I was in my way to the Napper Clinic for my first chemotherapy treatment, I was, in a daze of the confusion of COVID, but then also had my caregiver here, Nancy, my wife, and we went through it together. But I thank the entire chain of caregivers that I had. There's nothing better than a fantastic phlebotomist. I honestly,
Amen. Preach on.
and the nurses in the oncology ward are just fantastic. My nurse was there for me, and the one thing I remember the most is I felt like the healthiest person in the chemotherapy room. And I saw so many people that were so much more challenged than I was. And that was difficult as somebody going in. And I'll just end with, at the same time that I was battling what I was battling, I had a friend who was not surviving and who didn't. So that's also part of my story. So I often think of him and also know that I had a great care plan. They caught it at stage 3, and I was able to move on, and I'm here because of the care that I got from everybody within Geisinger, from the phlebotomist to the people that took care of me during my surgery to my surgeon, Dr. Bouzis, Dr. Khan, who was my cardiologist, Dr. Burke, who follows up with me all the time, and Dr. Panikar, who's just, he's a blast to see. I actually went to high school with him, and I don't even think he remembers that we played tennis against each other. But it's just nice to think about those things. It was and 5 years, almost 5 years in. So
Yeah, thanks for sharing your story, Jeff. And I'm glad to hear your success.
I am coming up on my 4-year anniversary on the 22nd. I had brain cancer, and you talked a lot about having trust with your care team, and that's something that I am grateful. I had a really good team that I truly felt like I could trust, and that made me obviously, like when you first start off at this journey, I was 26 years old when I found out that I had the cancer. I had a 2-year-old son and a 4-year-old son. So a lot of scary thoughts went through my head, but having people in your life that that really took the time to explain everything to you and that you felt like you could trust helped things to go in a positive way. I also used my cancer journey as a way to make some positive changes in my life. And about a year ago, I started seeing Dr. Nick, actually. And before I saw Dr. Nick, I was struggling with a lot of anxiety. Like this time last year, I had that fear that cancer's coming back, where he has helped me in so many ways, finding myself post-cancer now. And that this year, I'm seeing it in a positive light. There's no fear there. I'm seeing myself as a survivor more than a cancer patient at this point. So I thank you guys for sharing where you come from and being great providers for others and allowing people to trust in you.
That's wonderful. Thank you.
Yep.
Thanks for sharing your story. We appreciate that. So I'm getting hand gestures from the person I'm not supposed to mention. So, real quick, one sentence, your best advice to put survivors in the triumph over cancer category.
You
Real
go
quick.
first. You're smarter than me.
That's not true.
He just talks more.
Yeah, celebrate the moment you're in and the time you're in. You know, the future is anxiety, the past is depression. Be in the moment right now and celebrate that moment. That's my advice.
That went very quick. As I would say, just consider what's important to, like, in your life. If your family's important, make that a goal. Spend time with them. Your dog, whatever makes you happy, rather than, again, trying to focus on the negatives. And it's really easy to let the negatives soak in because your body's trying to prepare you for worst case scenario. But try and focus on, the fact of being a survivor and doing what you can to stay healthy and well and spending that time with your family. Again, focus on what's important and make those your goal.
That's great. And so we did talk about a lot of things today, and it was a great episode, and I thank everyone for being here. But from the bottom of my heart, I thank both of you on my family's behalf for keeping me here. But I will tell one quick story, and I'm going to ignore his hand signals. I will tell one quick story because it's a funny story, Dr. Bowen. Now, as many of you know, I travel, and I travel about twice a year. And when I come back, I either see one of these two people when I come back. That's generally how it works for me. This one particular one, a few years ago, I went to see Dr. Bowen. The day after I got back, it was 8:30 in the morning. I got back on that weekend, and he was doing his regular stuff, and and he says he took the X-ray and everything, and he got to the end of it, and he says, and he looks at the X-ray and he says, do you know you have a bit of metal in your stomach, in your gut? I said, what? What are you talking about? And there's a little pea-sized piece of metal in my intestines. You remember it? And I said,
Yeah.
And he said, where were you? I said, I was in England, and I had wood pigeon. I had wood pigeon there. It was buckshot. I had a bit of buckshot. And he said, you have this there. And I said, are you concerned about it? He said, not unless you are. So for a few days, I was waiting to hear strange noises when I went to the bathroom. It was also strange. I got deathly quiet,
Those are those fun encounters. That's success.
That's success. What a great way to end that episode, on success. Yeah. But success is big picture. It can be small picture. It's success is measured on your own terms. Find what that is. Tell your story, and that may help you find it. Courtney, you did. Tell your story. That may help you find what your success is. And don't be afraid to say it's success. Don't be afraid. And don't be afraid to tell your doctor it's successful either. Don't be afraid to tell them that I think we're doing all right here. Don't always say, well, there's going to be more medicines, there's going to be more this, there's going to be more that. Say, I'm feeling okay. And let them decide. And then you can, like I do, you can take his advice or not. You can, you can say, no, I'm not doing that. Excuse me. Thank you once again, everyone, for coming out. Sponsorships for the 2025 podcast recordings are now open. I'd like to thank Geisinger Health Systems, as usual, for their generous support. And they also provided our panel today, Dr. Bowen and Jamie Weeder. And I'm thrilled to have Geisinger as a partner. You've heard some success stories today. Those were from Geisinger. Those were from right here in our hometown. And the Mindset team, absolutely epic professionals. I'm not supposed to acknowledge him, but he's over there. Mark Burke. And he's absolutely an epic professional to partner with. If your company or nonprofit wants to plan a better future, call Mark and the Mindset folks. And I can't forget Len Persetta. Len's in the audience, as he always is. He's faithful. He is our Chief Encouragement Officer, and he's truly a master of so many things. And thank you for always being in my corner, Len. I appreciate that. Many people have asked how they can help. I've said this before. Turn up to the podcast. Help us out. And help us respond to the diverse needs of this community. You've heard today some serious triumphs and how to get yours, how to get your plan to that. I've mentioned sponsorships of our podcast. Please reach out to us at advocate@thesurvivorsjourney.org for more information. You can donate in several ways. Check out our website, thesurvivorsjourney.org. We have Venmo, GoFundMe, or you can mail us directly. And important, share all the information with everyone. Share it. We're on Facebook, Instagram, LinkedIn. We're all over the place. But share it and stay in touch. We are taking a break for the holidays because I'm a bit tired, and Dr. Nick tells me I should take a rest. Just like Santa did, I have to take a rest. So we will be coming back. We will be coming back in January for the next cancer conversations. And if I can talk some of the audience members to being panelists, I'm gonna do that. So in the meantime, I thank you all from the bottom of my heart for helping me and making this a success. We're doing very well with this, and we need to keep going. Len and I have got some big plans to make. In the meantime, once again, thank you, Dr. Bowen. Thank you, Jamie. I
Thank you
appreciate
very much.
I love you both very much. And
We love you too.
thanks. Yeah, I knew it. See, I knew it. Thank you all very much, and celebrate your journey, my friends.
As we close today's chapter, remember this. In every heartbeat of struggle, there's a rhythm of hope. I'm grateful to walk this journey with you. Stay strong, stay connected, and let's keep sharing the light of resilience together. Until next time.